guys, so it is 6:48 and we just got done with the first part of the Sickle Cell Patient and Family Symposium. So now we're all checked into our hotel room here at the Loews Hollywood Hotel, and now we have some free time. So I just wanted to catch you guys up. It was so amazing getting to meet some of you guys, some of you fellow warriors. It was really nice to see your perspective. It's just so interesting to see all the different topics we covered, and I'm so excited to see what tomorrow holds in store. So I'm here in our bathroom. Give you a little quick tour. So we got like a little bathtub, a little shower up there, a toilet. We're right in Hollywood, so love the picture. This is our sink, my phone. Actually, that's my mom's phone. Got some towels down there, toiletries, our little, I think this is our blow dryer. So we actually come in through here, and then our room is that way. We just kind of started setting up our stuff, so our things are a little bit all over our place. Mama Bear is very sexy here, taking a nice nap. Or not nap, just relaxing. Our feet are kind of swollen, so she's just resting. Alright, so here's our purses. We have a little closet over there. I forgot to show. So that was our door we enter. Bathroom closet is right here. Our nice full-size mirror we can see ourselves in. And then we have our snack bar. We actually just have some sodas here, TV. We have a little Keurig station, some wine glasses right there, a little ice thing. So I have my notes that I took at the symposium in here. They gave us a little swag bag, and it's the Sickle Cell Warriors Inc. International Association of Sickle Cell Nurses and Physician Assistants, Sickle Cell 101, powered by the Sickle Cell Community Consortium. I got this little water bottle. I actually have my Pedialyte here because I'm not feeling very well. I'm feeling very dehydrated. I'm having pain, so I have to drink that. Got my iPad and my little bag of medications in here. So it is about 6:40, I believe, and this is our lovely view. Hope you guys can see it. Yeah, so I'm so excited to be here in Hollywood and get to experience all of this. So yeah, guys, I'm gonna take you around. I think we're gonna go visit the pool and see what they have down there. Maybe I'll take a dip if it's nice and warm, but we're gonna go check it out. So I'm leaving you here, and I'll see you in a couple of minutes. Bye, guys. Hi, guys. So I am enjoying some free time. Here is a little shopping mall, so we're gonna go do some shopping. Here is our hotel, the Loews Hollywood Hotel. So I'm gonna take you along. Here's a little shopping mall we are gonna go explore.
When something happens, or after they've abused their body for 40 years, then they get in tune with their body. But we're able to get in tune with our bodies from the very beginning, from as soon as we start our lives, essentially. It gives us empathy and compassion. It allows me, when someone else is going through pain or going through an experience, it gives me an easy way to mesh with that person. And it moves you past sympathy, where it's not like you're feeling sorry for them. You really understand what people are going through when they're having tough times. And it makes you look less of a bitch, right? It makes you like a total nice person. No, like seriously, how many bitchy people have you met with sickle cell? Just think about it. How many? None. Because it forces you to be a nice person. Because if you're a bitchy person, people will treat you worse than they already do. Half of the semester, or you miss some exams, but you still want to accomplish that goal, so you keep trying. That's where the fortitude comes from. It makes you be better at time management. If you have so much energy today to do this much, it makes you work at it better, and you work ahead of yourself so that when you fall sick, you don't fall behind. At least that's how you're supposed to do it. It doesn't always work out that way, but that's how you're supposed to do it. And then you get better at multitasking as well. Multitasking and delegating. That's a huge one. I have this village mentality, so I'm living with like my sister, my cousins, my husband. It's like one big happy family. And so when I'm delegating, I'm saying, oh, I'm just being an effective communicator. When I'm delegating, then I would like you to take the trash out. And it works. It's just how you ask people. Set your long-term and short-term goals. Your long-term goal, for example, is to go to school. How can you make this happen? Set 3 short-term ideas that you're working on, this month, this quarter, this year, to make that goal happen. You just have to creatively find a way to make it happen. You shouldn't give up on our dream. Preparation and fortitude are the keys to success, and you can never over-prepare. That is something that I've learned. You can never over-prepare. It's better to be over-prepared than not prepared. Eliminate stressors and toxic negative relationships. Negative relationships are so draining. They're so draining on not just physically, but also on your psyche. And remember, we only have so much energy.
To use as vectors, because the job of a virus is really to infect a cell. That's really what viruses do, and that's what's the most important thing that they do. And that's really all that they do, because they're not really particularly smart. But they're really smart at infecting cells. So as I said, the most common vector is part of a virus that's been genetically altered to carry normal human DNA. The vector infects the target cell and delivers the functional gene, and proteins are created from the new gene. So here is an example of a viral vector. Here's the vector. Here's the DNA that's inside the vector, and then this little, you can sort of see a little bit, there's a dark part. That's the corrected gene. You take that, and you deliver it into the cell in question, and it gets incorporated into the genome. And then, as I showed you earlier, it has DNA in it, and you use that DNA and you make a protein, a functioning protein. So really, this is how gene addition works. Going back to your question, this patient had severe sickle cell disease, had vaso-occlusive disease, and hospitalizations in the whole 9 yards. And this was done to this patient, this process. The patient had this conditioning, which I mentioned, that kills all of their bone marrow, the existing stem cells of their bone marrow. These drugs that are given make you kind of sick. What they do is they deplete your entire immune system, because that's the whole point of it. This patient was given back his stem cells with the corrected gene in it, and this patient has been doing well ever since. Gene therapy is a complex process with a lot to consider. Look at all the questions you all have. It's really complex. But think about the ultimate effects and how you can manage disease in a one-time way. There's value there. Gene therapy may have the potential to provide doctors with a new and very effective way to treat severe diseases. And there's, as I mentioned in the last slide, there's ongoing research that's really focused on the improved safety and efficacy of gene therapy. And that's my last slide.
Medications, I can't stress that enough. Dr. Ifya Sampo yesterday talked about having an actual pain plan. To me, it's a little broader than that. You can have a pain plan, but if you actually have an established relationship with your provider, your pain plan should be embedded within a complex care plan so that you have more holistic care. But you should have some type of action plan in mind when you seek care. To communicate, the more you're going to be stigmatized and dehumanized. So the angrier you get, the more likely you are to not be able to communicate, the more pain you are in, which is because you haven't been treated. So it's almost like a cycle that you can't get out of unless you have some type of technique in order to navigate the system better and get what you need before you actually have a whole lot of pain. Who wants to interpret that for me? Extension time, stage 9.
This is my grandmother's favorite saying.
Interpret it. What is it? What your grandmother, what she mean by that?
It means take care of things when they're little before they get big and very difficult to take care of.
Right. If you get a little tear, if you don't take care of it, it's going to be a big rip soon. So apply that to sickle cell. If you can go in when your pain is a little lower, then you might have potential to avoid some of the stigmatization because you can communicate your needs better. So make sure you have a discussion with your providers as to what your pain goals are before you're ready to go home, both in the ED and in the inpatient setting. Talk about, before you actually get your medication, the larger dose of the IV medication, talk about the fact that sleep does not mean that you're not hurting and that you should still get your pain medication. Nurses, and I just did a service for nurses on oncology unit that we're going to get an influx of patients with sickle cells. Oh, they just want to be knocked out. Well, your cancer patients, you knock them out, they don't even ask. So, if you're in pain, I would love to, if I'm in pain, I would love to get something that helps sleep it off, because maybe I'll wake up more relaxed or whatever. But just because you're sleeping does not mean that you're not hurting. So continue to do assessments, etc.
We can turn it around. Even if you're intubated and multi-organ failure, we can fix that a lot of the time where we couldn't before. But not if you're in a hospital where the doctor doesn't know what's going on.
Right, exactly.
So if you don't have an advocate, I want you to call me or call us, get in touch with someone who knows where you are. We talk a lot about what happens in this young adult group. Like, why is this happening? And I think there's a lot of reasons. And some of it is poor transition. Some of it is bad behavior. And again, it goes back to, you're not going to listen to me, right? I can tell you all I want. Every young adult's looking for a little bit of independence and a little bit of freedom. And we don't, taking that all away doesn't help anything. Learning how to give it in pieces and parts is what we need. And some of it you got to learn for yourself. I mean, every really doing great 45-year-old that I talk to with sickle cell disease, every one of them tells me, I had to learn how to take care of myself. And maybe they just got lucky and they didn't get sick enough in the process and in a bad doctor's hands in the process, because not all doctors are good doctors. Yeah. I think having an advocate, someone who can speak for you, I can't even talk about how important it is. It's come up again this week in our clinic. But so if someone really is without anyone, then we try to provide that for them.
And then we had a session that we called Girl Talk, and we called the other one Guy Talk, and then we had Parent Talk. Right. So Girl Talk, all the women came together in a room. You had like 18 to 75. And they talked about what is it like to be a woman and have sickle cell disease. And the grandmother would tell her story, and the 18-year-old would ask all these questions and kind of talk about how, I just want to be normal. And then she'll say to her, baby girl, I wanted to be normal too. And when I did that, this is what happened. And then the boys would talk about, I want to have sex, I want to go party, and they'll talk about prerequisite and how, what triggers that, and what happens when you smoke weed and you have a pain crisis, all those things. And then we met, the parents met in a group, and we talked about how you need to let your child go, okay, and that there's some amount of support that is important, but you can't protect your child from becoming independent. Because if you do that, they will never transition. And we ran that program for 10 years. After we kind of got the older ones moved on, they became mentors for the Girl Talk and Guy Talk for the younger kids. From age 12 coming up, we met once a month. We had a group where we kind of set goals. What do you want to be when you grow up? What are your goals? Do you have any questions? Write me a little poem about what you want your life to be like. And they met with child life therapy, they met with psychology, they met with the nurse. They learned about sickle cell disease, what kind you have, what's your phone number to the doctor, what's your doctor's name, they didn't know my name, okay? Which was a little bit scary because when you fill out your SSI information and you write the wrong name, they don't get your records, you get denied. You'll be surprised at how many denials are because of very simple technical things. They wrote the name of the hospital wrong, so the request doesn't go to the right place. Or they misspelled Dr. Ife Osunkwo, they put Dr. Ife. There's no Dr. Ife in the phone book. It's Dr. Osunkwo. But they didn't know that. Or you don't know the fax number to the clinic, or you don't know the number to your pharmacy. So they had to learn how to get their information straight. They all had an app on their phone that they had to put their name, their blood type, their medications, what kind of sickle cell they had, and all of that. So we ran that for 10 years. It was a very resource-intense program, and there was no funding for that. So right now, that program is in a little bit of a shaky situation. Now, fast forward to where I am right now. And this was at Emory, so most of the patients had a mama, a daddy, a cousin, a grandmother, somebody in their family who helped them out. And we would talk to them. I'm in a place where, just like Julie said, 45-year-old guy, there's no mother, there's no father, there's nobody. So we had to rechange what we do to fit the environment where we were in. So I had this guy who's like 39, in the ER 350 times a year. He had nobody. Okay, his daddy died of a drug overdose. His mama got married to somebody else, and she's sick and tired of him. And go figure out. So he sees us every week for a year. So we are now his family. But we have such horrible social situations where you gotta rechange, you gotta modify the plan based on what's happening. You can't talk about transition to her. She's already seeing an adult doctor, but she has no idea about the Medicaid card, the phone number. That's all like secondary stuff. Let me keep you alive first. Let me get you out of the hospital. Let me teach you one thing at a time. So you have to modify that. Unfortunately, there is no program that gives everybody a peer support. You got to find a family member, a cousin. I mean, I call people's girlfriends, people's wives, people's mothers. I say, look, here, come for this appointment. I need you to be here because I need you to hear what I'm saying to this patient to help me out, to help them get better. I've called grandmothers, I've called friends from school. Well, tell me something on your phone book that you can bring with you tomorrow. You have to figure it out. But it's not always as easy to identify a strong support system. And if it's not there, it makes it a lot harder for them to move through that process.